92.7 KGBR. It's the bridge to all good music. More importantly, it's the bridge to all great listeners. I'm Bill Bailey. Thanks for tuning into the show. We have a special guest on this morning. I'd like to introduce Rebecca Moore. And you've got some big doings going on. You've been doing some cool things. You're running for a spot on the hospital board, right?
I'm running for position number 3 that I was appointed to approximately 8 months ago.
Okay. Tell us a little bit about your experience. This is not something new for you. You've done a lot of hospital work.
In 1995, I was hired as the night reception clerk, and it took a few years, but I worked my way up to Director of Business Services. I was very diligent in learning the hospital business and learning the systems, learning how the ER worked. I worked a lot in the ER with the nurses and the doctors. Long time ago, the night reception clerk would do many, many duties other than just answer the phone, go down to the ER, help with the patients, cover the nurse's station if there was no ward clerk or if the CNA was busy. So I got a lot of hands-on medical experience, as well as all of the ins and outs of the finances, the ongoings of the laws of Medicare and OHA.
Which is all very important in the position you've got right now.
Correct.
We talked a little bit about hands-on experience there. You've obviously got that in hospital work. You're like the only person on the board that does have actual hands-on experience in hospital work,
Yes,
right?
as far as I know, I'm the only person that has hands-on experience in hospital work, specifically at Curry General Hospital.
Administrative work, too. You've done a lot of that since 1995.
Yes, actually in 2001, I was part of the team who recognized that Brookings was invaluable to our survival and opened up our very first clinic down in Brookings on Alder Street, at which we recruited April Gothard from Northland Medical Center Gold Beach to run our Alder Street clinic down in Brookings.
Tell us why it's important. Why is the district important? Why is this position important?
All the way back in 2001, we recognized that over 50% of our income came from Brookings. We did not want to lose that market share. And I fear that other people don't understand that in order for the Gold Beach Hospital to exist and to be successful, that we really need to cap that market. I understand that Gold Beach and Port Orford people think that we are giving Brookings everything they want and they don't have to pay taxes, but the clinic down in Brookings pays for itself, and it also helps to fund the hospital and the Port Orford Clinic.
What do you see happening in the future besides, well, a new hospital?
The new hospital will bring new services, new orthopedic surgeons, more services, dialysis, infusion, a bigger expanded OB program, and we've had many surgeons come to this area and love it and want to be here, but we're apprehensive about using our current facilities because of the age of the facilities and couldn't wait for us to build the new hospital so that they could possibly change their mind and come back.
Why do you want to continue doing this?
I have a passion for healthcare. I have ever since I walked through the door in 1995. I have 4 children who use the facilities. My oldest son just had his tonsils taken out. Thank you, Dr. Williams. Just last week, I myself have had surgery there. My middle son had his appendix out. Thank you, Dr. Levine, just a few months ago. And we have complete faith in our healthcare here, and we always have. My husband was diagnosed with cancer several years ago, pancreatic cancer, which tends to take people in about 6 months, but with the awesome health care and Dr. Taylor being at our side 100% and Dr. Ward, we were able to get an additional 2.5 years. And we have a very young son. He's now 6, but he was just about 5 when my husband passed away. And thank you to Dr. Taylor and Dr. Ward for making that possible. And I've always had a passion for healthcare, and we've always used these facilities.
You're not going anywhere. This is where you want to be.
This is home. We own our home. We're not going anywhere. I have a 14-year-old son that's going to be a freshman in high school next year, so I expect many football injuries that will be taken care of by our local doctors. And, I've got a 6-year-old boy who's very athletic as well.
Well, if you were talking to somebody out there who wasn't sure which way to vote or why they should vote a certain way, what would you say that would tell them Rebecca Moore is the right choice?
I would explain to them that, for one, Curry General Hospital is the biggest employer in Gold Beach, and without Curry General Hospital, there is no Gold Beach. School attendance will go down, population will go down, businesses will close. With the hospital expansion, population will increase, school attendance will increase, businesses will blossom. That is also true for Brookings. Brookings is having a hard time getting people to move into their community because they don't have health care, they don't have an ER. And so with the addition of the ER, they're going to get at least 25 to 30 jobs immediately. When they expand the facility, which is about a $10 million expansion, they're going to get probably another 30 jobs. I don't even know how many extra jobs we're going to get here because the sky's the limit.
Do you think you have a good team in place right now with the board?
I think our senior leadership team is second to none. I am looking extremely forward to working with Virginia Razzo. She's very intelligent. She's very strong. She truly knows her stuff. I just don't want people to listen to the hype that we need to be completely and utterly dedicated to our constituents in Gold Beach and Port Orford without having services in Brookings, because honestly, without the services in Brookings, we aren't being responsible to our residents in Gold Beach and Port Orford. Because if someone else does move in to Brookings and takes that revenue share, we will collapse.
Well, Rebecca, thanks for talking with us this morning, and we wish you luck.
Thank you.
92.7 KGBR. It's the bridge to all good music. More importantly, it's the bridge to all great listeners. I'm Bill Bailey. Thanks for tuning in to the show. We have a special guest on this morning. I'd like to introduce Rebecca Moore, and you've got some big doings going on. You've been doing some cool things. You're running for a spot on the hospital board, right?
I'm running for position number 3 that I was appointed to approximately 8 months ago.
Okay. Tell us a little bit about your experience. This is not something new for you. You've done a lot of hospital work.
In 1995, I was hired as the night reception clerk, and it took a few years, but